Have you ever felt completely winded? You go to the doctor, they run some tests, and everything comes back normal? It's a super frustrating but really common medical puzzle. Well, today we're going to talk about the special test that's designed to solve that exact mystery, bronchial challenge testing. This is the big question that sends so many people to a specialist. You've got all the symptoms. You're coughing, maybe wheezing, you get short of breath when you work out or you're around certain triggers. But when they do that standard breathing test, spirometry, it says you're perfectly fine. It's a classic medical mystery, and it can be maddening. So what's going on? Often, the answer is a little thing called airway hyperresponsiveness. It basically means your airways are just a bit twitchy or overly sensitive, but they only act up under very specific circumstances. And that's where bronchoprovocation testing comes in. It's how we can safely recreate those conditions in a lab to see exactly how your lungs react. It's the key to the puzzle.
All right, here's our game plan. First, we're going to dig into the diagnostic puzzle itself. Then, we'll open up the toolkit and look at the two main ways these tests work, direct and indirect challenges. We'll get specific with the two most common tests, the methacholine and exercise challenges, and finally, we'll see how doctors put all the clues together to crack the case.
Okay, first things first. Why even go through with one of these specialized tests? What are we really trying to find out here?
Well, it usually boils down to one of four key reasons. The number one reason is to finally diagnose that hidden airway hyperresponsiveness we were just talking about. But it can also tell us just how severe that sensitivity is. These tests are also used to screen people who might be exposed to toxins at work, and finally, to check if a treatment for something like exercise-induced asthma is actually doing its job.
Now, it's not a one-size-fits-all situation. These challenge tests fall into two main groups based on how they get a reaction from your airways. We call them direct and indirect challenges. And this diagram shows the difference perfectly. Think of it this way. A direct stimulus is like it's knocking right on the door of your airway's smooth muscle, telling it to tighten up. An indirect stimulus is a little more subtle. It talks to some other cells first, these intermediary cells, which then release the chemicals that tell the muscle to squeeze. Two different paths to the same result.
And here are some of the actual agents they use. On that direct side, you've got chemicals like methacholine and histamine. They go right for the muscle. On the indirect side, you've got things that are much more like real-world triggers, right? Like exercise, or substances like mannitol. They get those intermediary cells to do the work.
So let's zoom in on the most common direct challenge there is, the methacholine challenge. This one is really the gold standard for figuring out exactly how sensitive a person's airways are.
Okay, to understand this test, you have to know this one crucial term, PC20. It stands for provocative concentration 20. So FEV1 is just the amount of air you can blow out really hard in 1 second. The PC20 is simply the exact concentration of methacholine it takes to make that FEV1 number drop by 20%. That's the target.
And how do they give it to you? Well, there are two standard ways. The first is the 5-breath dosimeter method. It's super precise. It gives you an exact squirt of aerosol for each of 5 breaths. The other one, the 2-minute tidal breathing method, is a bit simpler. You just breathe normally from a nebulizer for 2 minutes.
This is it. This is the magic number, 20%. It doesn't matter how they deliver the methacholine, the goal is always to find the dose that causes this specific 20% drop in your FEV1. If your lung function dips by 20% or more, that's a positive test. It confirms your airways are hyperresponsive. This chart shows you exactly how they track it. So on the side there, that's your lung function, your FEV1. And along the bottom, that's the dose of methacholine getting stronger. You start at your baseline up top, and with each new dose, they measure again. You can see the lines start to drop and drop until, bam, it crosses that 20% threshold. The dose right at that point, that's your PC20. Okay, let's switch gears and talk about the indirect tests, specifically the exercise challenge. This one is perfect for people whose biggest complaint is, I only get short of breath when I'm actually moving.
So when would a doctor pick this test? Well, it's the obvious choice for that classic case. Symptoms only show up when you're exerting yourself. It's also a great follow-up if a methacholine test comes back negative, but you still have symptoms. And just like the other tests, it's perfect for checking if a therapy is working or for screening people like athletes or soldiers whose jobs are physically demanding.
Now, this is a really important distinction. The threshold for a positive exercise test is actually lower. Why? Well, think about it. For a healthy person,
Exercise should actually open your lungs up and make your breathing better. So, if your FEV1 drops at all, even by just 10 or 15%, that's a pretty big deal. It strongly suggests exercise-induced bronchospasm. And wow, this graph is just a fantastic visual of what's going on. That big, light blue loop, that's a person's normal breathing at rest. Nice, full breaths. Now look at the black line. That's them after exercise. See how much smaller and squashed it is? That represents a huge reduction in how much air can move, and it's the classic sign of EIB.
So, we've looked at the tests, we've seen the numbers, now for the most important part, putting it all together to finally solve the puzzle. What do these results actually tell us?
So let's just do a quick recap of those different cut points. For methamocholine, we're looking for that big 20% drop. For mannitol, another indirect test, it's a 15% drop. And for exercise, or a similar test called EVH, it's that lower range of 10 to 15%.
But it's not just a simple yes or no. The number itself tells a story about how severe the issue is. And this is really the bottom line. If your PC20 number is super low, less than 1, it means your airways are extremely sensitive, and a diagnosis of asthma is highly likely. But on the other end, if it takes a really high dose, more than 16, to get any reaction, then asthma becomes very unlikely. Everything in between helps the doctor pinpoint the diagnosis based on your symptoms.
And that brings us right back to our original question. For anyone out there who has been fighting with these unexplained symptoms with normal test after normal test, the answer might just be found by pushing your airways just a little in a very safe, controlled way. A challenge test could be the one thing that finally unlocks the diagnosis and gets you the answers you've been looking for.